This is a Fertility Friday podcast, episode number 67. Welcome to the 67th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from FertilityFriday.com, and this is your source for information about the fertility awareness method and all things fertility. If you've been enjoying the show, I would love it if you take a moment and leave a review and a rating on iTunes. It helps the show move up in ranking so that more people can find it. And of course, I'd like to say a special thank you to all the listeners who have left reviews already. I do read all of your reviews, and I really appreciate you taking the time to let me know how I'm doing. And also, make sure to head over to FertilityFriday.com and join my email list. This way, you'll be the first to know when I release a new blog post or a new podcast episode or anything else exciting that's happening at Fertility Friday. And this year, I'm actually opening up my schedule to see clients. So if you're in the midst of learning about the fertility awareness method and you want someone to walk you through the basics of charting and help you to gain confidence in interpreting your charts, you've come to the right place. Just shoot me an email at info@fertilityfriday.com and we'll set up a free 15-minute Skype consultation to find out if we're a good fit to work together. And in today's show, I'm very excited to welcome my guest, Rachel Eyre. Rachel is a reproductive health practitioner out of Guildford, UK, who specializes in fertility massage therapy. Rachel teaches natural family planning, and she is a holistic health coach, and she incorporates Reiki, reflexology into her practice, among other modalities. And Rachel works with women suffering from PMS, painful, heavy, or irregular periods, and fertility issues, and so much more. So in today's show, we'll be talking all about fertility massage therapy and how learning natural family planning has informed her practice. So without further ado, welcome to the show, Rachel.
Hi, thank you for having me.
Well, thank you so much for coming on. So my intro was really short, but I would really love for you to tell the listeners a little bit more about what you do, but also what inspired you to get into this field of health and fertility.
Well, it was a bit of a serendipitous thing, actually. So I started off, I was really, really sick, and I had a background in various different therapies to start with, and it was sort of through my own healing journey. So just to give some background without going into it too much, I had PCOS, which was diagnosed when it was either 9 or 10. It was quite young, and I started my periods really young too. And I had really poor health in general throughout my childhood, teens, and even early 20s. And I kind of got to the point where I hit sort of rock bottom. I've been on the pill for about 20 years, maybe in total, but for about 15 at that point. My periods, even with the pill, were ridiculously heavy. Sometimes I'd end up in hospital. And then other things happened, like migraines. I got pneumonia, proper pneumonia, not just the cold. I had stomach problems. I had problems with all my gut. I was just really, really, really sick. And I started thinking, well, you know what? I understand science. I understand anatomy and physiology and all the rest of it. I'm going to see if I can find any alternative suggestions, because I was under the care of 8 different specialists at this point, and none of them could help me, and they were arguing over what medications I should be on, etc.
That's intense.
Yeah, I was on 40 different medications a day.
I can't even picture that. That just sounds like so many.
It was pretty crazy. So just like 8 steroid tablets when I got up, several different inhalers, some preventative medications for various problems. Every time I ate, that was at least 3 to 4 tablets, plus Gaviscon and goodness knows what else. So if you can imagine, it just sort of adds up every few hours having to take the next batch of stuff. So it was pretty bad, and I felt terrible as well. And I was trying different things to fix everything else. And I thought, you know what, I've tried fixing the pneumonia and the liver problems and the rest of it. And even with surgery, I wasn't feeling that much better. What about the PCOS? Because that can lead to diabetes, and it turned out I did have diabetes by that point. And a friend of mine had been studying nutrition and said, maybe you should be looking into it. And I started doing some formal nutrition training. started doing loads of evidence-based research and went to my doctor and created a diet for myself, and that was great. I reversed my diabetes, and then I was like, well, this is really interesting because even though I was on the pill, I was seeing a slight difference in my period too. And then, sort of by another stroke of fate, I went to this expo. It's called CAM Expo, and they have it every year in London. And it's the Complementary and Alternative Medicine Show. And the lady Claire Blake, who was just starting up fertility massage, was exhibiting there. And I'd spoken to her the previous year, but I'd just not had sort of the ability to do the training. And this time I did. So it just felt like she was starting off this training. I was available to do it. So did it. And it just got me absolutely hooked with periods and things. And then I started exploring further. Just in case anyone's wondering, my health got drastically better. I've lost 5 stone, reversed diabetes, and I'm on no medications. And I have a perfect 28-day cycle.
Wow. And
no period pain. A red bleed.
That's amazing, especially considering where you started out. And what's a pound equivalent of 5 stone for the North American folk?
So it's 14 pounds per stone.
Oh my goodness. So 5 stone is like 70 pounds?
Yeah, roughly.
Wow. Okay, that's insane.
It is. Yeah, I think it's exactly 70 pounds.
Way to go, Rachel. Holy.
Yeah.
That's really how over how long did it take you?
6 months in total.
And that was from making a dramatic shift in your diet.
It was real food. And I had to do a little bit of calorie restriction at certain times as well in order to kickstart my metabolism. But it was all done under the supervision of my doctor, who, thank goodness, she was so open-minded and willing to let me go with, the research I found.
And was your intention, sorry that we're getting into the weight loss, but
that's right.
I think it deserves a little bit of a time to delve into that. But was your intention to lose weight, or was that a byproduct of...
I was unhappy with my weight, and I did obviously want it to go, but I've been told it's very hard to shift if you have PCOS. So my main focus was my health, because I was fed up of being in hospitals all the time. Mm-hmm. It's pretty hard to pay your bills when you're sick. Yeah. So, that was my main focus. And I was fed up with being tired and sick all the time. So that was my main focus. And the weight loss was really just a bonus.
Mm-hmm. Well, to kind of get our feet wet into our topic today, I was reading your blog and I noticed that you had a recent entry. So in the entry, you said that you had recently attended a fertility show in London.
Yes.
And so someone came up to you afterwards and was kind of like, so, why are you here? So the show was about fertility, and you had your booth about periods.
It was actually the fertility massage therapy stand that we were on.
Okay.
So
and I think, sorry, what struck me was that it was like, what are you doing here? Periods have nothing to do with fertility.
Yes. What was even worse was she was an exhibitor in the stand next to us.
Yeah, so maybe we could start off by talking about that connection between menstrual cycle health and fertility, because it's one of my favorite topics. And especially because for you, when your health turned around, it wasn't just like it wasn't just one thing in isolation. I mean, you said you lost the weight, you feel a lot better, you're off a lot of the medications, or all. I'm not sure if you're off of all.
I'm off all of them.
Okay, and then also you mentioned that your cycles are like super healthy, and so it's obviously like one thing can't happen without the other. Like you can't get super healthy without your menstrual cycle improving. So maybe we could talk a little bit about that.
Okay. Which one did you want me to talk about first? The show or the...
Yeah, maybe you can talk about your experience there.
Yeah, so she'd heard us talking about womb position, and she couldn't understand how periods and what the bleed looks like, which is one of the things in fertility massage that we look at. So, for example, is it a bright, clear red bleed? Does it have clots in it? Does it have dark stuff at the beginning or the end? And various different things like that. We ask people, and what signs and symptoms do they have just before and during their period? And all that gives us an idea of where the womb is situated. So it might be retroverted, which means the top of it's bent slightly back, or anteverted, where the top of it's bent slightly forwards. Or you can get retroflexed, which is even bent right in half all the way back, or antiflexed, which is bent all the way forwards. And this presents in all sorts of symptoms. So if it's bent all the way forwards, most of the month it doesn't have that many symptoms. But when your womb is at her most full, just before her bleed, say it's bent forwards, then you're going to get this dragging sensation or an increased need to urinate because she's pressing on your bladder. And equally, if she's bent backwards, it's going to be pressing against the nerves in the back or the rectum. So you're going to get difference in bowel movements, or pain in the lower back, or migraines, or pain down the back of the legs. But also, if that happens, then the blood, instead of freely coming out during your bleed, starts pooling in that bit that's bent backwards, and then it starts impacting. And that's that dark, icky stuff that you can get at the beginning or the end, or both ends of your bleed. And that obviously, if you've got that impacted stuff there, you've not got the healthy womb lining that you need for a little embryo to implant in.
And so this woman at the show heard you talking about bleeding and couldn't fathom how one has to do with the other, which I find to be so interesting.
And even the fact that when you're freeing up all the congestion in that area, so a lot of women have a lot of congestion in their pelvis because they're sat still for 8 hours a day from 9 till 5 a lot of the time. And that restricts the blood flow going through into the tissue. So your womb isn't getting as much blood as it needs to provide a healthy endometrial lining. But also you need that nourishing blood to nourish the eggs and help them mature. So you can eat really, really well, but if you've got lots of congestion in your pelvic area, the blood and all the wonderful nutrients you're eating aren't going to reach their destination.
Okay. Well, so many of my listeners may remember that I've done a few shows on sort of fertility massage related topics. So I'll link to those episodes in the show notes in case that's something that interests you. So I did have Dr. Rosita Arvigo on the show, and we talked about Arvigo therapy. I did a second show about Arvigo therapy as well, and so that really gets into the uterine position and how that impacts the blood flow and circulation, and just even the logistics of if your uterus isn't in alignment, it just makes everything more difficult. It makes fertility more difficult, makes your periods more difficult. And then I also spoke with Marie Whitman, and we talked about Mercier therapy. So it's kind of, they're each their own separate, modality, but at the same time, they're kind of connected in terms of the methodology, because you're physically moving the uterus to achieve proper alignment.
Yeah, each therapy looks and feels completely different, but we all have the same aim, and we all want to help women with womb issues.
Well, and maybe you could talk a little bit about, so let's picture, the woman who isn't in alignment. What does that look like? So if a woman was in alignment, generally speaking, of course, every woman is different, but what do her periods look like? What do they feel like? And maybe you could talk a little bit about what proper alignment actually means.
Okay, so if everything is good, I should point out, actually, you can have your womb not being in its perfect anatomical position, but if you don't have any constriction or adhesions holding her in place, she can move around a bit, so she can move upright to make your bleed easy. And it's only when you have adhesions and things, which unfortunately, if she sort of gets a bit trapped because you're very constricted as you sit down, can happen.
And sorry, what is an adhesion?
An adhesion, so it's essentially quite similar to scar tissue. So, for example, endometriosis leaves adhesions. So it sticks like glue, hence the name adhes. It sticks bits of tissue together. So if you have an adhesion holding her in place, she will be stuck in place. And you can sometimes break adhesions down with a manual therapy, such as fertility massage therapy, Arvigo, etc. Or castor oil packs can help with that sometimes.
So even if you're in proper alignment, if you have adhesions, that's still impairing the blood flow and the circulation type of thing.
Yeah.
Okay.
But even if you're not in proper alignment down there, then if you don't have adhesions and she can move around, because most women, their uterus does tend to sit to the left or the right anyway. It's very rarely she upright. And mine still sits fairly far back, but I know she moves around because I can feel it when I'm massaging myself.
Hmm.
It's only if she's constricted that it's a problem. Some women have to go and have surgery to get the adhesions removed, especially if they've got really bad endometriosis. But there are various different ways they can try first before they get to that stage.
And so adhesions impair the motility, so they kind of impair
Yes.
the uterus, the ability to kind of shift with.
Yes, and then that usually gives the sign of cramps during the period. So, if, say, for example, your uterus is tilted backwards and she's got adhesions holding her in place, she can't move back upright. So, instead of moving upright to pump the blood out, she's going to twist from side to side and do whatever movement she can to try and empty.
Oh, okay, and that's when, because of course, I think this is a great conversation because
Mm.
I'm actually picturing the uterus kind of inside the abdominal cavity, but to actually think of the uterus as not just a stagnant thing that's just there. We're actually talking about it. But in terms of the when a woman's bleeding, the uterus is actually contracting, like smooth muscle contractions to actually
Yes.
help the blood come out. So if the uterus isn't able to move freely and contract the way it needs to, that's where the pain comes in. I think that this is fascinating me, and this is actually something that I haven't spoken about specifically, even though I have delved into the topic of uterine massage quite a bit.
Yeah, that's one of the main things that the uterine massage really, really helps. And has anyone ever spoken to you about dancing fallopian tubes?
Not specifically.
No, so your fallopian tubes, they're usually slightly behind the uterus, but they should be able to move around freely if there's no congestion or adhesions there stopping them from doing so. So if you've only got, say, for example, your left ovary working, but no fallopian tube going there, if there is no constriction, the right fallopian tube can move across and receive the egg and move back into place.
What? I didn't know that. That's
It's brilliant.
insane.
Isn't it amazing what your body can do?
Okay, so I think I just need to sit with that for a second. So what you're saying is that the uterus can actually, because I know one of the things. So for the listeners who might not be so familiar with the anatomy and physiology,
Mm.
so I mean the fallopian tubes are not connected to the ovaries. So
No, they're
that
not.
I
It's an
know.
open system.
And so when a woman ovulates, the egg is released into her abdominal cavity, and then the fallopian tubes draw the egg into it through Mother Nature's brilliance. So I don't
Yes.
know. But that's a thing. And so I think that's an important base for this conversation because the ovary and the fallopian tubes are not connected. So yeah. But I didn't know that. So if the uterus has free a movement and ability, then that's something that can actually happen.
Yes. It's
Wow.
pretty astonishing.
So
And
how
I
did
have
you
had one or
learn
two
that? Where did that knowledge come from? Because now I'm fascinated.
from that came from the fertility massage therapy training, and I have had two ladies conceive who have the egg and the not the egg, the ovary and the fallopian tube on opposite sides.
Oh, wow. And that's just something, again, in Mother Nature's brilliance. Why we have two
It is.
fallopian tubes, why we have two ovaries. And yeah, wow.
But,
Okay.
but again, only if there's no constriction in the pelvic cavity.
Wow. So then, okay. So then to kind of summarize what we've been talking about, because yeah, this is fascinating. So if a woman has adhesions, and those can be caused by a number of things, so it can be caused or if, related to endometriosis, and I'm
Hmm.
sure if there's been any types of trauma, I'm guessing, or
Yeah, any kind of scar tissue in that area. Even just being in the same position every day can, in some women, cause them to form.
and a lot of us sit and they're saying sitting is the new smoking. So there's
Yes.
all kinds of it's just Marie Whitman spoke about that when we did our episode together about movement for fertility, and she talked about how big of an impact sitting all day makes and how important movement is, just to make sure your body's in alignment. So I think that that's interesting that adhesions can form because of inactivity.
Yeah.
And so those adhesions prevent the free movement of the uterus, which then impairs the uterus's ability to function optimally, because the uterus is not just this stagnant organ. The most I've learned about the uterus and the muscle, I'm sure that you learned way more than I ever did, but when I was preparing for pregnancy, I took a hypnobirthing class, and so if anyone has ever if anyone's interested, the hypnobirthing comes with a book. So there's a book called Hypnobirthing, and in it they talk about the uterus. And so it was the most detail that I've read about the muscles and the different layers of muscles in the uterus. So you really get a sense that the uterus is like a really heavy duty muscle. And there's all these layers to it. And so it's a very dynamic organ.
Yeah, there's actually 4 ligaments on either side that a lot of people forget about, and 2 holding the ovary in place. There's a lot of tissue there that can potentially get sort of knotted, a bit like muscles get knots in, if you think of it in a similar perspective.
And so then talk a little bit about fertility massage then, what you do, how you can identify where the issues are, and then how it helps to release the adhesions and to improve the mobility of the uterus and everything.
To be honest with you, a lot of the identifying what's going on, you can ask what sort of signs and symptoms people get throughout their bleed. And before you ask me what's the sign of something in line, so someone who's healthy should have a sort of 26 to 35 day cycle. Their bleed should be between 3 and 7 days, and it should be bright red and relatively clear, maybe a few little clots in it. But when people start saying, I have period pain, I have PMS, I have menstrual migraines, I have pain down the backs of my legs, I have changes in bowel movements, I have the increased need to urinate, or a dragging sensation, all these just before and during the first few days of their bleed. First of all, that's not normal. There's lots that can be done about it, and it does frustrate me that all these women are told, oh, it's completely normal, we'll put you on painkillers, just put it on a pill, and it's not actually correcting the underlying condition. If they want to be on painkillers and the pill and other medication, fine, but there are plenty of things that can be done to actually help with that. And when we do the massage, it's not overly prescriptive, as in if someone has this symptom, you do that. We still work on the ligaments holding the womb in place on either side, and just getting some more space in the womb, and also working on the abdominal area so that the blood vessels feeding into that area are free and not constricted at all.
Mm-hmm. Well, and I mean, when you think of the uterus as a muscle, and you talked about the ligaments holding it together, and you think about what massage does, what it is, I mean, massage by its nature loosens up the muscles, increases circulation, reduces pain. If you have knots, everyone knows that, it not only does it feel good, not necessarily during, but if you have a knot or something like that, but that releases and relaxes them. So I mean, logically it makes a lot of sense, but maybe you could speak a little bit as well about how the impact, so how it affects women, what types of conditions. So we've talked about menstrual pain and fertility. So maybe you talk a little bit about how it can improve fertility and improve some of those menstrual symptoms.
So if your womb is bent over backwards or forwards and she's not able to move easily, then you're going to get the cramps that I mentioned, or just severe pain in that area. But also you're going to get this sort of dark, icky stuff, and that's this impacted endometrium that's really old. It's not got any nourishment to it anymore because it's dead blood. Like a scab goes brown, its blood gets old and turns brown. So you're improving the quality of the lining by helping your uterus move and eliminate all that old stagnated blood. And also, if she's in a better position, then you're not going to be in so much pain when you have your bleed. But this means that then you've got a better surface area for the embryo to implant on. And then making sure that you've got all the right amounts of blood going to the uterus and to the whole pelvic area, actually. So the uterus needs 5% of the total body's blood, which is actually quite a lot if you think about it.
Yeah.
In order to function properly. And if she's not getting all of that, that means that other things that travel in the blood, so oxygen, nutrients from the food you eat, hormones, they're not getting through to where they're supposed to go, or they're not getting through in the quantities required to trigger off various different events, such as ovulation.
Well, and I think that it's so interesting. So when you talk about periods in general, it's often associated just with being gross and dirty. And often there's this idea that our menstrual blood is dirty or toxic. And there's certain religious practices that kind of embody that belief that a menstruating woman, is dirty, essentially. And the interesting thing is that when you talked about the endometrial lining and how if it's not emptying, it can be stagnating, the endometrial lining is essential for a baby's development. That's where the egg implants, and a healthy endometrial lining it's like the most, it's not the most, there's not one thing that's the most important, but the endometrial lining is responsible for bringing, it's without
It keeps the egg alive.
Exactly. Without it, you don't have a pregnancy. And so I think that was a point that I think I spoke to Dr. Arvigo about, but it's a point that I think, warrants mentioning again, because if you're thinking about getting pregnant, then you need to have the healthiest endometrial lining to hold that baby, and that's where the baby grows. And so if you have stagnated blood that hasn't been, if your uterus is out of alignment, if it's not able to drain properly, then, what's the baby growing in, right?
Yeah, or it usually just doesn't implant properly because it doesn't have the correct texture to it for the embryo to implant.
Yeah. So hopefully the listeners can kind of come away from this episode with a different appreciation for the role of that endometrial lining and for that menstrual blood, because I think part of the reason why we menstruate is obviously it's just part of the cycle of life, but it's also it plays a very specific role in supporting the life of that baby. And so it has to be fresh, it has to be healthy, it has to be, you have to have a healthy endometrial lining. So so I love that. So so I'd love to hear a little bit more about your practice. So you studied holistic nutrition, and so at what point did you incorporate the fertility massage, or did you do that right from the start?
I started off with the fertility massage and then added on the nutrition on top, because I started off with nutrition for myself, and then I was thinking, well, hang on, no, I can help other people here. And at the same time that I finished that off, I was learning the natural family planning teacher training. And then I realized that I had this window into what was going on in women's bodies. So the two came into my practice at roughly the same time.
Yeah, no, that's fantastic. So I'd like to delve into the nutrition part of it, but maybe first we could talk a little bit about the natural family planning. So how did you come across it, and what made you, I mean, it's very obviously related to what you're doing, but how did you come across it?
So when I did the fertility massage training, we covered Billings, which is a mucus-only method. And when I started researching fertility and cycles in more detail, I saw lots of forums with people arguing whether BBT, which is the basal body temperature charting, or Billings or any other mucus method was best. And I was thinking, well, hang on, why are they saying this? So looking at the basal body temperature charting, yes, I could see the limitations in terms of if you drink alcohol or if you're sick, etc. And then other people were saying you just need to check your mucus. But then I could see the limitations there because you obviously might have what looks like a peak day, but if you're stressed, then you could have a false peak day because your body's just said, no, it's not safe to conceive right now.
Oh, and then have a
I'm
double
going to stop.
peak
Yeah,
and you think you
and
ovulated, but yeah.
exactly. And you haven't, so you need the temperature to check. And then I found symptothermal charting and just looked around different training providers and came across natural family planning.
Hmm. Well, and so what was your experience like learning natural family planning, and how did it inform your practice?
Oh, it blew my mind. Literally. I remember the first time I was given a chart of someone who was pregnant, I was like, oh my goodness, this woman's pregnant. It was so exciting. I couldn't believe that you can see that. But then, first of all, obviously, we're taught to look at it from a point of how someone can use it to spot their fertile window to achieve pregnancy, but also to avoid pregnancy. And then we started looking at a few different things, such as if they're not getting the correct thermal shift, if they're only getting like a mild rise, starting to look at Luff syndrome. And then I was thinking, well, actually, I can see here, if someone's got a true luteal phase defect, because a lot of women will say, yes, I have a 30-day cycle and I know I definitely ovulate. But then if you look at how you break down that cycle, for example, some women that come off the pill, you tend to see quite a long follicular phase and then a shortened luteal phase.
Mm-hmm.
But they think they've got a normal cycle because they know they ovulated, and it's 30 days long.
Yeah. Well, sorry, before I want to touch on that a bit more. You mentioned Luff syndrome if they
Luff
didn't have
syndrome.
a proper temperature rise.
Yes. So I know NFP is a bit unusual in that we qualify the temperature rise. It has to be at least zero point 0.2 degrees C. And that's to check that it's a true ovulation, as in the egg has been released. If it's less than that, then the egg sort of gets stuck in the follicle. I'm just trying to think of what its full name is. Luteinizing and rupture follicle syndrome.
Oh, okay. So then
You get a low progesterone rise and it dies off.
and that's because the ovulation didn't fully come off,
No, it's
and
sort of
the egg kind of
stay.
gets stuck.
Yes.
Okay. Well, and I think that just speaks to, because we talk about this a lot on the podcast, and it speaks to the power of the chart as a diagnostic tool.
It really does. It's just fascinating what you can see. And also, if you're trying to improve your fertility or your overall health, you'll often see your chart starts changing.
Mm-hmm. Well, because as we touched on when you were introducing yourself and telling us a bit about your story, when you improve your overall health, your fertility follows, because
Yes.
fertility and health go hand in hand.
Yep.
And I think it's so interesting and just heartbreaking that in our lovely culture and in our media and everything, we still haven't figured that out, and we still think that women can separate their fertility from their health. So we still think that we can take hormones and shut down our ovaries for 2 decades or whatever, and that it has no impact on the rest of us because we have somehow compartmentalized our bodies, and we seem to think that our fertility happens in isolation. And our ovaries aren't really part of us. They're just there. They don't really have an impact on our whole body. And so, yeah, I'm going to get off the soapbox now and get
You're preaching to converted.
Yes. But of course, it's not just for me. It's for all the listeners as well.
Yeah.
So, but yes. So then you were talking about how the different variations in a woman's cycle. And I think that's such an important point, that so many women can see their 30-day cycle, and the only thing we're trained to think of is the number of days, and not even how long your period is, just the number of days of the cycle. So if you see that you're having a 28-day cycle or a 30-day cycle, you just, well, I'm regular, I'm great, everything's fine. But as you said, if you look deeper into the cycle, you can actually be ovulating, regularly. You can be having a perfectly regular cycle in terms of being 30 days every month and still have massive issues with your menstrual cycle. It could still not be healthy.
Yeah, I think just about every sign of the cycle that you chart, as well as every detail of your bleed, is gives you a key to something going on in your body. It's so fascinating.
Hmm. Well, and you had mentioned some of the things that you've seen for, if a woman has gone off the pill. So have you worked with, I'm guessing that you've worked with women who've come off the pill. And so what are some of the things that you've noticed?
Most of them do get a return of their periods, but it's usually the whole cycle is quite wonky. And usually it can be around 30 to 60 days rather than the standard length. Some women, it will return to a sort of normal shape within 3 or 4 months. Others, it can take up to 2 years before they even get their first bleed. But one of the things that I find really interesting, if they are charting their cycle, then they can start looking if there's signs of anything happening. For example, if they're getting any cervical mucus at all, is it changing from the tacky quality to the fertile quality? So they can start seeing if they're working on their nutrition or if they're having massage or even if they're having reflexology, if they're looking after themselves or even if they're just reducing stress, because that could be about 6 different podcasts on its own, how stress affects the cycle. Um, but if they're trying to change their health, then just charting these things, they can see whether there's an improvement or whether it's starting to head in the correct direction or not.
Mm. I think that's a really good point because, I mean, it's still frustrating for a woman who is waiting for her period to come back, even if she does use charting and is able to see
Mm.
her mucus signs, to see the mucus and then, not ovulate and then see it again and not ovulate is also frustrating. So I'm not going to
It is very
minimize.
frustrating. I've play that down. It can be very frustrating for some women, especially if they're really keen to conceive.
Well,
Uh,
but I think what you're saying is so important as well because then if you start to see that, then there's something about having that visual and having the experience of witnessing your cycle change based on, your health changes.
yeah, and what you're doing. So you might see that some things you do cause an improvement, um, but sometimes your cycle gets a bit worse. But if you're charting, you look back and go, "Oh, I had to do an exam, or I had a massive deadline at work." You can see how things impact your personal cycle, and that sort of threshold for what counts as stress for
Mm-hmm.
us is all different from person to person. So you can start to get to know what things mess up your cycle and what things don't. And some people are really sensitive to certain foods, and other people aren't.
Mm-hmm.
So you can really start to nail down what it is that affects your cycle.
And so if you're sensitive to certain foods, how can that show up in your cycle?
Ah, that was a brilliant question. So, um, some people I know, myself included, um, I've got PCOS, so I have to be really careful with my blood sugar levels. If I'm even slightly naughty, so a lot of people say, oh, it's fine if you eat well 80% of the time, you can eat rubbish 20% of the time. But for me, it's pretty much 95/5. So if I have 2 squares of chocolates, my cycle won't change. If I have a whole chocolate bar, I tend to get spotting or a longer period. So I know that it flips estrogen dominance on for me really quickly, and I've got quite a low tolerance to sugary foods.
Hmm.
But there are other women who, they can eat soy and then suddenly they've got loads of fluid. So
Mm-hmm.
for them, that's something that really triggers it off in them.
But I imagine for a woman who's listening, she found the podcast today. Maybe she was searching for fertility or something or massage.
Mm.
And so she's never, she's not familiar with fertility awareness or natural family planning. And maybe this is the first time she's heard about this. And to hear a woman have such insight to her menstrual cycle, to know that, I know how much chocolate I can eat before it affects my menstruation. And I know why. And I know that it affects it this way and it lengthens my period. And that type of insight, there's like a quarter of a percent of if that of women in the world who have that level of insight about their menstrual cycle. That in of itself is a tragedy because it's not so complicated. I think
No.
For women
I
who
think,
are starting to chart, I think that you hear all this stuff and it sounds overwhelming, like, oh, that's real nice, but I'm just trying to figure out like how to check my mucus. But women will realize within, 2 to 3 full charts. So after you've had 2 to 3 periods while you're charting, you really do start to get a sense of it. It just comes with experience, because when you're
yeah,
paying
I will say it
attention.
took me 2 years to get there.
Yeah, yes, exactly. You weren't just like the first chart and you were like all in tune with nature, I'm guessing.
Yeah, no, not at all. The first two was a bit fiddly trying to work out, how the temperature has to be in the middle of the box. I don't understand why. Figuring out the cover line. Oh, right, yeah, I get it, definitely. It is really overwhelming when you first look at a full chart and go, oh my goodness, how am I going to fill this in? Um, but then once you're doing it regularly, you start adding in more and more layers of observation because you can.
Yeah, no, absolutely. And one of the things that just occurred to me as well, I've touched on a bit in the podcast the difference between natural family planning and fertility awareness, which is essentially kind of the ideology behind it. But
Mm.
so did you have the option of learning from like a secular fertility awareness teacher where you live, or was it just more available, or did you, so what was the reason that you chose to learn through natural family planning teachers?
In all honesty, it was the most accessible course for where I live. There isn't, I know it used to be taught within the Catholic Church, but now there isn't any restriction. And in fact, that would be illegal in Europe anyway. If someone wants a service, regardless of their background, you have to give it to them. Um,
Well,
so,
isn't that interesting?
yeah, it's been that way for 10 years. It's amazing how many people still think that you have to be Catholic. To be honest with you, it's natural family planning in the UK is run by, there are a lot of people who are Christian or Catholic backgrounds in it, but the main person's actually a GP that helps interpret the latest research.
Well,
So
yeah.
to me, I found them really warm and open. I've never been asked what religion I am or anything like that. So,
Oh, okay. And were there any like specific teachings, or was it just very open, like these are your fertile days, you can do what you want in them? And
um, but there is it technically isn't natural family planning if you do use any other method during the fertile days.
yes.
But there isn't any need to stop people using another method during those fertile days. It's about informing them and letting them make that choice for themselves.
Well, and in that vein, it sounds exactly the same as, secular fertility awareness teaching, because technically it isn't fertility awareness if you use a condom on your fertile day.
Mm.
Technically, you're using a condom on your fertile day.
Yeah, exactly. Technically, it's not NFP if you're using a condom, but if someone wants to do that, I'm not going to stand there and preach at them, and I don't know anyone else that would.
No, and the important thing is to have that awareness and understanding. Like
Mm,
it gives you options, right? Like when you have that knowledge, then you decide what you're going to do with it.
exactly.
So I just thought I'd ask, because I know it depends on where you live, and I know a lot of my listeners are in the United States, and I'm guessing that there's no law like that there.
I don't know. I'm
Throwing it
amazed
out
by the
there.
number of people that assume I'm a Catholic. Where did that come from? Oh, LFP, right? Okay.
Well, no, that's really interesting. So to switch gears a little bit then, when you have a client who's struggling with fertility issues, we've kind of touched on it, but maybe you could address it more specifically. How do you approach fertility issues with clients?
So, first of all, it depends whether they've got an actual diagnosis of anything, because that's quite helpful to start with. But in my consultation sheet, I ask the basics that we've covered before about the quality of their bleed. So, how frequently they bleed, for how long, what colour is it, what's the texture, do they get any pain? If so, where? Um, and that usually gives me a clue as to what's going on with their womb position. Some women chart their cycle, so some might have already started doing temperature charting, which is great because it gives me an idea as to whether they're ovulating already or not. Other women have started doing fluid charting, which is great because it gives me an idea of whether the body's trying to ovulate or not. Usually they're quite open-minded if I give them a pre-recorded lesson that they can go away and learn to chart. And even if they're not really sure about the, marking in the cover line, if they can just start plotting on there what's going on, just get their observations down, I can talk them through how to, complete the chart and then what it means. If it sort of comes up with something that highlights a potential medical condition, so I mentioned Luff syndrome before, but other things would be luteal cysts. I've come across a few of those recently in women that definitely can't be pregnant, but their charts are saying they are.
Okay, maybe you could just deepen into that a little bit. And so what does that mean? And then what does it look like on the chart? And how does that affect the woman?
So your egg, whether it's fertilized or not, for a little while will produce something called HCG, which is a hormone. That tells the leftover follicle, which is turned into this white fibrous material called a corpus luteum, to secrete progesterone. And then the progesterone has a thermogenic effect on part of the brain, meaning it tells it to heat up the body, and effectively act as an incubator until the placenta grows. If the egg hasn't been fertilized after roughly 2 weeks, depending how long your luteal phase is, the egg dies off and it's no longer producing HCG to tell the corpus luteum what to do. The corpus luteum, however, can occasionally get a benign cyst on it. So even though the egg isn't telling it to produce progesterone, it is anyway. So you'll still get the progesterone telling the brain to keep the body warm, so you'll still have this temperature rise.
And so then, any woman who's listening who's read anything about fertility awareness will know that 18 high temperatures indicates pregnancy. That's essentially a positive pregnancy test. So then in this case, a woman can have 18 plus days, but no, they're actually not pregnant.
That's correct. And obviously, if you're in that bracket, don't panic, but you do need to get it checked out because the cyst can cause the fallopian tube to torque, which cuts off the blood supply. So, but it happens over a period of time. But you need to get it checked out.
And so then what typically happens? So then you have 18 high temperatures, and then eventually it disintegrates, like the cyst disintegrates, or.
In some women it does, in some women it doesn't. They can be self-resolving, but if you do have those 18 high temperatures and you're definitely not pregnant, I just refer people on to their doctors straight away because they can get a scan and work out whether it's a problem, whether it needs treatment or not. Because if it does talk, then you can get, this is an extreme case, I'd just like to point out, but you can get gangrene in the fallopian tube and then you need it removed. So if you catch it at the very beginning and go and see your doctor and work out whether it's likely to cause that or not and get it checked out and monitored, then you can avoid that whole situation to start with.
And then, okay, so you have 18 high temperatures, you pee on a stick. Does it show a false positive or does it just show negative because you're not actually pregnant?
It should show a negative. Okay. To be honest with you, I've just referred people straight away because
to the doctor.
Those women have been not, they've not had...
Oh, no, so it's fully not even a possibility. They could be, okay, I see what you're saying. I get it. Well, just because, I get questions from listeners here and there, and so I'm sure that some of the listeners would want to know these answers too. Yeah. So I'm not trying to quiz you, but just trying to get a sense of what this might look like so that, because I think that I just love all the different implications of charting that come out when I speak to other, educators in the realm. But because of course
oh, sorry.
Oh, no. I just think it's because, this is something where, because there's always exceptions and there's always special cases. And so it's important to know what's happening, especially because left untreated, this could be a significant health challenge. So.
Yes. just to go back to your point about the pregnancy test, in theory, they shouldn't have a positive pregnancy test because that shows the level of HCG hormone in the urine. But in this case, the corpus luteum is producing progesterone without that signal from the egg. So the egg has died off.
Yeah, so then there wouldn't
So
be
theoretically, they
they wouldn't
shouldn't.
be the hormone because there's no egg to produce. Because the pregnancy test for the human chorionic gonadotropin,
Well done.
HCG. Yeah, just to throw that out there. But the test, the pregnancy test, when you pee on a stick, it tests for something that the embryo, blastocyst, whatever stage it is, tiny baby, is producing. And so if there's no fertilized, egg growing, then yeah, I'm sure there's medical conditions where a woman can have a false positive pregnancy test, but because the test is specifically testing for a hormone that's produced by the egg, if you have a whole bunch of high temperatures and the pregnancy tests are negative, then that's definitely it's time to go to the doctor and get everything checked out.
Absolutely. So other things then, obviously things can change when they start having massage. For example, their bleeds can change dramatically, and even happen later and later or earlier and earlier until they switch cycles. So I've had someone whose cycle shifted by 2 weeks,
Oh wow.
which was pretty amazing. And also, if they're eating differently or looking after themselves and de-stressing, you can start seeing changes come through. But other things that it's particularly interesting for actually is luteal phase defect, because I know there's lots of people that just start taking vitamins and particular herbs for luteal phase defect, but actually there's sort of several layers of what happens there, and you can literally go through them in order and see which one corrects it, so that you don't need to take a herb that stops working when you get pregnant because you can't take it then, and then you might miscarry. So it can give you a bit more power over that part of your cycle too.
Well, and that's one of the very, very common challenges, because a lot of women who are struggling with fertility are coming off a pill. And as you mentioned, for some women, it takes 3 to 4 months before they even get their first bleed. Not a healthy cycle, just the first bleed.
Yeah.
And for other women, it can take up to 2 years or more to get their first bleed. And we're not talking about a healthy cycle yet. So the luteal, and then it's common for women coming off of hormonal contraceptives, like you said, for their cycles to be wonky for a while as their body's healing from, the hormones and everything. And so it's not uncommon for women to have a luteal phase that isn't long enough. So it's a common question. So for the listeners out there that are wondering that or experiencing that right now, where they see that their luteal phase is like 7 days or something, what are some of those things that you go through with the clients that you work with?
Well, I work to a sort of a level or a layered structure, and you have to deal with layer one first. Otherwise, if you deal with anything else, if you haven't dealt with layer one, then it still won't work. You'll still have a short luteal phase. So layer one is stress. So stress, it's pretty amazing what it does for the body, and it's there to protect you. So if, for example, you're being chased by a wolf, you'd want to be able to run. So your body increases your heart rate. It thickens your blood so it can clot faster if you bleed, so that the predator can't find you as quickly. It does lots and lots and lots of things. It'll empty out your digestive system lower down and stop digestion higher up. So the other thing with stress as well is it wants to not only divert the valuable resources like blood to the correct organs and muscles to help you run away, but it also tells your body that it's not safe to conceive. So if you're overly stressed in the first half of your cycle, you tend to see that get longer. And if you're overly stressed in the second half of your cycle, you'll see it get shorter. Because in the first half, it's trying to delay ovulation from happening, hence you get all these false peaks. And then after you've ovulated, it wants to stop the pregnancy as soon as possible, so you'll get your bleed. So that's the first way stress can affect you. The the other thing as well is stress produces a hormone called cortisol, which is pretty nasty for all your other hormones. Again, it's essential for certain things, but in high doses and at the wrong time of day, it can mess up all your other hormones. So, for example, the hormone you need to make cortisol is called pregnenolone.
Mm-hmm.
And you have a finite amount of pregnenolone at any point in time. And pregnenolone makes both cortisol and progesterone. So if you're making more cortisol, you've got less base substance to make progesterone. So you're going to have less there. The other thing as well is that cortisol blocks your progesterone receptor. So you might be producing enough progesterone, but it can't talk to its receptor because cortisol's in the way. So you get all these women slapping on progesterone cream, and it's not going to have any difference because their progesterone receptor is blocked.
That's a very literal relationship between stress and your menstrual cycle.
Yeah, it's just incredible the different effects that stress alone can have. As I said, you could probably do 6 podcasts on stress alone and still have a million things to cover.
So just to sit with that again, so then if you have high levels of stress, you said that you have a certain amount of pregnenolone, and pregnenolone is what produces cortisol and progesterone. And so if you have high levels of stress, that means that more of that pregnenolone gets basically put to make cortisol. Then you have less available to make progesterone.
Yes.
And so I had an entire podcast with Dr. Jerry Lynn Pryor about progesterone and the importance of it. And so progesterone, you need it in the second half of your cycle, and you need enough of it to make sure that the second half is long enough. So that's directly then related to the luteal phase defect. And then if you have high levels of cortisol, it blocks your progesterone receptors as well. So then the progesterone that you have isn't even being utilized to the fullest extent.
No.
So double whammy, ladies.
It is.
Okay.
That's the most common cause of luteal phase defect in most women. So if they're not addressing the stress, as I said, you could be slapping on the progesterone cream head to toe, like 2 inches thick, but your body can't do anything with it.
Oh, wow. Okay, so that's the first layer then.
Yeah. And then stress can be caused by insulin dysregulation. So if you've got any kind of blood sugar issues, for example, PCOS, diabetes, if your blood sugar level spikes too high or too low, then your body goes into a slight emergency mode to try and fix it. So you start producing more cortisol again.
So then if you're eating like a really sugary diet, or just like most of us, like bread is like sugar, and so high carbohydrate, then that in of itself causes your body to release cortisol. So that in of itself is like a stressor on your body.
Yeah, it can be. It's worth pointing out we're all completely different. So some people like me will always have insulin resistance, and we're going to be far more sensitive to sugar. Other people can cope with a much higher quantity without it affecting them. So again, this is why it's really important to chart your own cycle so you can find out how sensitive you are to the different things.
Yeah, because there's not going to be one answer for every single...
No, it's different for everyone. We're as different on the inside as we are on the outside.
Okay, and are there any other factors that you wanted to talk about with regards to the how you look at the luteal phase defect?
There's lots of others, but each one would take a very long time to explain. Okay. But I then would look at things like estrogen dominance, thyroid, etc., and it gets deeper and deeper and deeper. But those start getting really, really technical. So, but if everyone could just start by looking at their stress and going to bed on time, a lot of luteal phase defects would start resolving themselves over time.
Yeah. Well, I appreciate you for talking about that, because I know a lot of listeners have questions about it. And I think it's also important to know, I think that our conversation lends itself to that concept that if you have luteal phase defect, taking something like that whole idea of I'm just going to take a pill or I'm going to take an herb and everything's going to be fine. I think it's important to challenge that idea because it's almost never that simple.
Unfortunately not. It usually, if it was to be truly effective, and it is in some cases, once you've gone through all those other layers, then you get down to, okay, take the herb and it works. And you only need to take it 2 or 3 cycles and then you've got a permanent change. But a lot of women find as soon as they stop taking it, their bleed happens. So they're not making a permanent change. So it's not actually helping them in the long term to take that. And you can't take it whilst you're pregnant in lots of cases. So,
and that's because you're not addressing the underlying stress.
Yes.
Nutritional deficiencies, thyroid condition, what have you in your own case that is causing this, because nothing happens in a box. It's not like you just have like a perfectly healthy 100%, everything's great, and a luteal phase defect.
No. In fact, that's a definition of something's not healthy.
All right. Well, as we come to the close of our interview today, there's a couple of questions that I wanted to ask to wrap up. So what would you say is the most important thing a woman should know when she's trying to get pregnant? I know it's not an easy one.
Well, I'd say 2 things. One is if you can start charting your cycle just so you can get to know your body, that is pretty amazing. It gives you so much power over what she's saying to you, and you can slowly learn. You may need some help, but you can learn how to interpret that and start seeing how what you do changes that. And I don't think anything could ever replace having that empowerment. And number 2 is if you think your body is broken and you're not getting fertile, there are unexplained cases of infertility. But again, if you go back to learning what your body is saying to you, and you may need help with this by seeing someone to teach you, but you can start to understand what is going on and really work with your cycle. And even if it's a case of you're not getting pregnant, but your cycle's really healthy, then you know it's possibly your partner to look at.
Yeah, no, I couldn't agree more. So next question is, what would you say is the biggest myth about fertility that you'd like to see corrected?
So many. It's probably that everyone's fertile all the time or everyone has the same cycle. Either one of those.
Oh, yes. As I roll my eyes inside. Why do people still believe that? But of course they do. Everyone, I shouldn't. I'll just stop. Rant over. Okay, before it even started. And for a woman listening who is currently on the pill, this is the last question of the day.
Yeah.
So currently on the pill, doesn't want to get pregnant now, but is thinking about getting pregnant in the next few years. What advice, if any, would you give to her?
I would see what you can do about coming off the pill. I wouldn't come off it without seeing your doctor first, because you may have an underlying condition, which is why you're on it in the first place. But certainly when you're looking at coming off it, a lot of people think that you should be on the pill, and then the reason why people are against the pill is because when you come off it, you're infertile for a while, and often fertility can return straight away. But the pill really burns down a lot of your vitamin and other micronutrient reserves, and you really want the chance to have the healthiest baby possible and the healthiest pregnancy possible, and you want to feel good. Well, everyone wants to feel good. That's the whole point, having a body, to feel joy in your body. And if you can come off it at least, some people say 3 months minimum because that's how long it takes for an egg to develop, but I would say ideally a year or 2. And if you've got an underlying condition, I know from my own personal experience, I was terrified to come off the pill because I had terrible, terrible periods that had me in hospital sometimes. But there are things often that can help that condition. And if you start reaching out to practitioners that can help you with that, then you can start making changes and hopefully move past that fear of coming off the pill, and then start nourishing your body for hopefully a healthy pregnancy in the future.
Oh, those are wonderful words to end on. I couldn't agree more. Um, so thank you so much for being here today, Rachel, for sharing
Oh,
your
thank you for
knowledge and
having
your
me.
wisdom. I really enjoyed our conversation. It was so much fun. And
It
I
has been.
think, yeah, and it went by really fast. And I think that a lot of the listeners kind of are taking their jaws off the floor, with some of the things that we talked about, because we really got in depth in a lot of the menstrual cycle charting. And I think that the listeners really appreciate, for you to delve into some of that today. So, for anyone who's listening who was intrigued by our conversation, wants to learn more about you and what you do, how can they get in touch with you?
I have a website. It's called thehealthyroom.com. Nice and easy to remember. I also have a YouTube channel with lots of videos with me with my little knitted womb showing dancing fallopian tubes and other things. So,
Wonderful. I want one.
yeah, I get sent them in the post by random friends.
That is
I've got a
fantastic.
collection of 3 or 4 knitted uteri now.
That's awesome. And I love that you said uteri, because I say that all the time because I'm a super nerd. Because what is the plural for uterus? It's not uteruses.
Uteri.
It's got to be uteri.
Yeah.
All right. Well, thanks again, Rachel.
Oh, thank you for having me.
Thank you for listening. If you enjoyed today's show, please share it with a friend. I'd love to hear your thoughts on today's episode. So just head over to the show notes page and let me know what you found most helpful from today's show. So you'll find the show notes page for today's episode at fertilityfriday.com/67. So the number 67. And if you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. And make sure to head over to fertilityfriday.com and join my email list. This way you'll be the first to know when I release a new blog post or a new podcast episode. And if you have an idea for a podcast episode or guest suggestion, just shoot me an email at info@fertilityfriday.com. I appreciate all of you for taking the time to tune into the podcast, whether you're on the go, commuting to work. Thank you for hanging out with me for a little bit today and letting me be part of your day. So thanks again, and as always, until next time, be well and happy charting.